suggest at least 10-minute bouts of exercise. So they are trying to help people incorporate exercise into their days by suggesting that you can do exercise in 10-minute bouts, and there is also research showing 5-minute bouts is equally effective. And then the part about the truth that it's never too late to exercise, you know, for many people that we talk to, exercise has not been a big part of their lives. And now here we are having had cancer and told a billion other things in addition to hearing or being told that exercise is also something you need to now start. Well, it tends to be one of those things that's very difficult because most people have not grown up through their lives with exercise or with sport participation. And so one of the research studies that I think is quite promising shows that it's not really about what you did before having cancer, and it's not really about how much you tend to do, but it's about that change. And so any change in activity that you can do post cancer diagnosis is an extremely important correlate or factor associated with quality of life. And so I really like this study and many studies that have come since it because it does demonstrate that we often hear, well, I've never exercised, that's the least of my worries right now. And what this suggests is that any little change is extremely beneficial. All right, exercise myth number 5. Exercise is only for people who want to lose weight or get bulky. And we often hear the lose weight part more than anything. Unfortunately, exercise has been sort of plugged together with weight loss. And really, it's not just about weight loss. And our research across a number of reviews of studies in every cancer population that's been studied shows that there's actually tons of benefits across the cancer continuum. So just to give you a sense, I know this is really small text, but I just wanted to give a sense that the myth being that it's about weight loss and getting bulky. So if we're talking about weight loss, exercise benefits range from anything from reducing risks of mortality to improving immune function, health-related quality of life we've spoken about. Fatigue is a funny one because fatigue is always that one where people say, I'm already exhausted. I can't do exercise. It'll just tire me out even more. I won't have energy to even get home. And what we see across the board in every research study is that exercise, a program of exercise actually helps with fatigue. And the mechanisms are not yet completely understood, but some level of exercise in your day actually helps with fatigue. So it doesn't necessarily make you more tired. Other related factors that make sense in terms of fitness, body composition, bone health. So we see one of the biggest risk factors after going through cancer treatment, especially for women, is osteoporosis. And exercise can help mitigate some of the negative effects of the treatment on bone health or reduce risks for osteoporosis. And then we also see in terms of physical well-being, so it improves everything from sexual functioning, sleep, balance, blood pressure, and decreases things like pain, blood pressure, resting heart rate. From a psychological perspective, which is what my research tends to focus on more, quality of life, mood, body image. We do research on post-traumatic growth and gives people a sense of control, which I'll talk about in a second as well, which is extremely important, especially during the most trying times of the cancer continuum. And then decreasing levels of depression, anxiety, stress, emotional irritability, etc. And then one factor that's often left out of the literature is the social benefits of exercise. And often what we see is that if you're the type of person that likes to exercise by yourself, but you talk about exercise with other people, you'll find more and more people that support you in that. If you're the type of person that likes to have group type exercise, you gain social support through that. We saw social support gains, tremendous ones in the breast cancer dragon boat groups because many of the women in those studies told us that they didn't join these programs to gain social support. They already had it in their lives. They had people who supported them. They didn't need social support. But what happened was, through the process of exercise, they saw that exercise gave them this idea, this ability to talk about cancer if they needed to, but to then not focus on it and to focus on all other aspects of their lives, which was tremendously rewarding for them. Exercise, the benefits of exercise show reductions in risks of recurrence. And so not eliminating it completely, because we don't know the mechanisms associated with not only the morphological mechanisms around cancer, but also around the mechanisms of physical activity. But what we can say is that it does reduce the risk. This was just one study that's actually often represented in the medical, in many physicians that I talk to and that I work with across in Montreal and in Toronto know this study very well, because obviously physicians are most interested in mortality and reduced risks of mortality. Now this study is a longitudinal prospective study of, again, breast cancer survivors over time, and showing that 2 to 3 hours of brisk walking after a diagnosis shows 45% risk of lower risk of death, and lower, that should say lower, physical activity after diagnosis, 4 times greater risk of death. And so the balance there of this study being a longitudinal study over time and with a large representative sample suggests, again, that physical activity after diagnosis, so it doesn't matter what you did before, and there's no better time than tomorrow to start, shows lower risk of mortality. The second part of the slide of the myth, if you remember back, I talk a lot, is that exercise will make me bulky. And one of the funniest stories that we had in one of our studies, we took the dragon boating philosophy and tried to apply it to a group of women who were overweight, because we saw how tremendously beneficial dragon boating was for women with breast cancer, and we thought, well, let's try to do something a little bit different in the intervention world for women who want to lose weight. And we set up this intervention and we gave them dragon boating and we went out with them in the boats. And after the first practice of dragon boating across in this group of women, one woman said she was dropping out because she gained 4 inches in her arm circumference, and she certainly wasn't there to gain arm circumference because she didn't want to gain muscle mass. And we thought, I mean, we said, that's great, thank you for telling us, and we hung up the phone, and then we said, wow, if our intervention's that good, we need to patent this right now, because no intervention would ever show that kind of benefits. But you know, the reality is that many people, and especially for women, they don't want muscle mass. It's just about toning. And so one of the fears around weight training in particular is that you're going to gain bulk. And most exercise that we do doesn't build bulk. So the majority of anything that anyone is going to do in this room is likely to not build any kind of bulk, but the benefits being improves balance, improves pain, and improves metabolism. So all of those things should factor against the fear of gaining any kind of bulk, because I can guarantee you that it's not going to help. And I just have a couple of quotes up here from some of our patients in different exercise trials, but one woman said, I can push myself off the couch, I surprise my family, I surprise myself. And this was, her story was, she couldn't even get herself off the couch, and one day she heard, about halfway through the physical activity intervention, she heard the kettle whistle go, and she thought, oh, I'm going to get that, and pushed herself off the couch and went and got the kettle. And her son and her husband were there, and they looked at each other, and then she stood up, and then she looked at them, and she said, oh my God. And that was a pivotal moment for her, seeing that exercise gave her that ability to do something, getting up off the couch, that she hadn't been able to do for many months before that. And then, of course, this comes back to the whole bulk thing, but this woman being very proud of her arms after, this was a dragon boat woman. So myth number 6, exercise will make me more tired and compromise my immune system. So we kind of covered the tired. You know, I've mentioned that exercise improves energy levels. It helps people sleep better. We've heard a number of stories of people who've had tremendous difficulties with sleep, and through exercise training of any kind, whether we're talking just adding little bits of exercise like is on the handout, to larger scale interventions, individuals talk about how beneficial it is for their sleep. They actually get sleep, which is tremendous. And then It also does, research is now looking at immune function in terms of physical activity and immune function, and we do see that it helps build immune function. Of course, I put the caveat up there that the environment has to be clean and a clean, welcoming environment for that improvement. Myth number 7, no pain, no gain. We often hear that in the exercise world, and I just needed to put that up there for anyone starting an exercise program tomorrow, that exercise should not hurt in order to gain benefits. And that's probably one of the biggest misnomers in the general exercise world, is that I need to feel it in order to know that I'm doing something. And again, one of the best messages I can give you today is that any little bit is beneficial. And so if it does hurt, you're probably doing something wrong. Also, know to recognize muscle soreness versus joint pain. So we often have discussions with individuals around, well, my elbow really hurts or my knees really hurt. And those kind of pains are not something that you should work through without seeking the advice or help from a trainer or from a physiotherapist, because those kind of joint pains are something that's not related to exercise. There's no muscles in your elbow joint or your knees, for example. And then the last point there, that there's no evidence that suggests that exercise leads to lymphedema or makes it worse. That was the reason why Dr. McKenzie initially started the dragon boating theme, was to dispel the myths that women could not do upper body exercise after having had a mastectomy. And so he went out and said, well, what's the activity that women do exactly with their upper body? Because I'm going to show the world that this is inaccurate, that they should actually be exercising. And so that's where the whole dragon boating phenomenon came from. Myth number 8, you don't have to go to the gym to exercise. Any exercise. So my comment there, exercise is exercise is exercise. You don't have to go to a gym. Anything that you do outside, if outside is for you, if you have an iPad or a tablet of any kind or a phone, there's many different apps out there that can help you exercise. It's fun to just see what's available. Everything from having displays of big cities around the world that you can put in front of you so that you can feel like you're cycling through San Francisco, to challenges that you can do for yourself that you can tell the app, you know, I want to walk for 10 minutes today, and then you can log it, and every day it logs it for you to keep track of it. And again, just adding activity choices using the strategies that we've talked about a little bit today are all exercise forms that I highly encourage instead of, or if the gym's for you, then that's great, but many people do not say that the gym is their most favorite place in the world to go. There's many different strategies that you can find in terms of doing exercise in the comforts of your home. You can do things like arm lifts with laundry jugs or with soup cans. You can move from soup cans to laundry jugs when you get stronger. You can use brooms to do arm lifts, or you can do the sit to stand off your ottoman or off your sofa. Using the stairs in your house to walk up and down. If you walk in the park, using different points in the park to speed walk a little bit. So one of my favorite strategies is when I am walking, is I think, okay, between this lamppost and this lamppost, I'm going to walk a little bit faster. And I do. Or I think to myself, I'm going to walk fast until I get to the next mailbox. And so you walk fast until the next mailbox. I don't suggest you use telephone booths as your primary point, because many of them are gone now. So you might be walking fast for a long time. But take advantage of the environment that's already available to you in terms of exercise. Myth number 9, if you're physically active, you're not sedentary. And this is a big area of research now, because the evidence suggests that sitting and sedentary behaviors are very different than physical activity. And so at this point, I'll get you all to stand up one more time. And stretch if you need to. Move your legs. Stay standing if you want. So stand during this slide. And I'll just tell you that the researcher at the Mayo Clinic said that excessive sitting is a lethal activity, and showing evidence that outcomes of sitting behavior and sedentary time are actually as bad for us as not exercising. And so they're separate activities. You can be very active and also very sedentary. And you can be very sedentary and not at all active. So they're separate behaviors that we call the active couch potato or the lazy exerciser. And just this graph at the bottom here shows you what I mean by this. So if you typically go for one exercise session during your day, you have your whole day where you're sitting on the couch or at work or wherever you are, on the computer, at the TV. You go for one walk, and then you come back and you sit for the rest of the day. Then the area under the curve here, or what we say is activity, is very minimal. This is what we would call the active couch potato. On the other hand, if you do little bits of activity and get up like you are now throughout your day, kind of stand up, walk around when you can, and incorporate little bits rather than that one long walk, the area under the curve is much bigger. You're much more active by incorporating small steps rather than one exercise session into your day. So this is where all those little lifestyle strategies can come in very helpful to help you gain exercise throughout your day. Okay, you can sit down if you want. So there are sedentary guidelines now in the Canadian Society for Exercise Physiology. These are only for kids at this, or adolescents at this point, but I highly suggest that within the next few months, these exact same guidelines will come out for adults, recommending no more than 2 hours per day of leisure time sitting or screen time. How many people do more than 2 hours a day of sitting? So again, exactly. So do I. So these are some strategies that people recommend in terms of gaining less sitting time. The walking, the treadmill desk, and the walking meetings. Instead of meeting people and sitting, you can actually walk and talk. Same thing if you go meet a friend for coffee or for tea. You don't have to sit there. You can actually take your coffee and walk. Maybe not on days like today, but most of the days. And then my favorite myth is there is a perfect exercise. And every time that I talk to the media, this is always a question I get. Well, what's the best exercise? Even yesterday when the students at Western called for their newspaper, that was a question I was asked. What's the best exercise? What are you going to tell as your main message that's the best exercise? There's no best exercise. The best exercise is the one that you, each of you individually, will actually do. Because if I tell you that walking is the best exercise, but you hate it, you don't like walking, then it's not really a good exercise for you because you're never going to do it. If I tell you that the best evidence was on treadmill running, how many of you are actually going to go on a treadmill run? So the key is to find the activity that is enjoyable, that's interesting for you, that you can actually do, because we tend not to do things that we don't like or we can't do, and that is something that's in your choice. Something that you can actually choose to do because it gives you some control. And so everybody in this room may have an exercise that fits this a little bit differently. Tends to across the board be walking, but I encourage you to keep that idea in mind because it really is about finding that one exercise or a couple of routines that you feel that you can do and that is enjoyable to you. And really, my big message here is that is exercise really ever enjoyable? You know, we often hear this, and these are medieval torture devices, and I would estimate that the exercise machines are actually developed around them. Again, another example, medieval torture device, or and again, hand dynamometer, or don't even want to guess what those are.